like this one.
Good morning. I'm Dr. Maurice, Sholas, known online as Doc Mo Show. I'm a board-certified pediatric rehabilitation medicine doctor, and I'm here to talk about kids with disabilities and how parents can advocate for them.
Okay. First question, Doc, we got to ask.
Yes.
What is pediatric, say that again?
Peds physiatrist, Peds rehab,
Yes.
Peds PM&R, they all mean the same thing.
Okay.
We are board-certified physicians that care for children with acquired or congenital physical disabilities. So nobody chooses to come see a Peds rehab doc. They end up having to see us because of some accident by birth, accident by chance, or something unfortunate that leaves a kid not developmentally typical.
Okay, okay. Is there some sort of ailment or developmental issue that you see most often?
The most common congenital physical disability is cerebral palsy. The most common acquired physical disability is from traumatic brain injury. Okay. So I take care of kids with cerebral palsy, spina bifida, traumatic brain injury, paralysis, missing limbs. So basically anybody that has some sort of physical disability that lasts longer than a couple of weeks will need services from somebody like me, be that medical interventions, medications we can prescribe, PT, OT, or speech, or I should speak it out, physical therapy, occupational therapy, speech and language pathology, braces, orthotics, prosthetics, all those things to make a child with any sort of physical disability more functional and more able to move on a typical developmental arc, and trust your medical provider enough to let them tell you the truth. Not what you want to hear, not what you're hoping to hear, but the best truth that they have to provide. And secondly, give yourself time to grieve that, however that looks. Some people just need to cry for a minute. Some people just need to get their mind right, as my mother always said. But give yourself a chance to mourn what you perceive is the loss. And then after you do those two steps, you're able to then look for the new path forward. And the exciting part of my job, because everybody's like, oh, is it really depressing? No. The exciting part of my job is I help people figure out a way to win when they didn't even know there was a pathway to get there.
Very interesting. So is there some maybe common things that we can do as parents that can prevent some of these issues from happening?
Well, I believe in car seats. I believe in wearing seat belts. I believe in appropriate sized kids doing appropriate things. For example, I'm not a fan of children on four-wheelers or golf carts. Now, I'm also not a huge fan of children on trampolines. Now, I probably should be a fan because all those things keep me in business. But in all seriousness, the best thing I can advocate for are safe practices, safe issues. Now, for congenital things that people are born with, there's really much less you can do outside of, you can prevent spina bifida, for example, by ensuring you have a good, strong diet, multivitamin, and are not deficient in folate. You can ensure as best you can that you won't have problems with cerebral palsy by making sure you have routine visits with your healthcare provider and making sure there's no things that put you at risk for problems with gestation, pregnancy, delivery, or shortly after delivery with your baby. So there's good, healthy practices for prevention of acquired things, and there's just good living to help prevent some of the congenital things.
Okay, okay. We hear a lot of talk about now with concussions and teenagers, even younger than that.
Yes.
Can you speak about that and just how that affects the brain over time?
So I have mixed feelings about talking about concussions.
Okay.
The mixed feelings is that, number one, people, parents, families need to know information so they can make good choices. But on the other hand, you want to make sure people don't get information that ends up making them hypervigilant, overly stressed out, and they try to wrap their kids in bubble wrap and don't let them do anything. So, there's finding a balance. So to start with it, a concussion is a form of traumatic brain injury. Now, it's a mild form, so it's not one that would automatically require you to see someone like me in pediatric rehab medicine. I deal with the more catastrophic versions or variants of that more regularly, but some of my colleagues that focus in sports medicine may do concussions more often. What do we know? We know the more concussions you have, the poorer your thinking or cognitive outcomes on the end. There is no number to say if you have 2, that's too many, or is 5 too many, but we know people that have 5 do worse than people that have 2. do worse than people that have one, do worse than people that have none. You know, so it's a continuum. The second thing we know is that children hit their head and you know, and bang themselves, but every bang on the head does not result in a concussion. So I think that's where the sort of balance needs to come in. Like if you're standing up from getting your books out of your book sack, and as you stand up, you hit your head on a locker, that won't necessarily have the force or vigorousness to cause a concussion. It could, but that's one of those things where if we push this information so vigorously and aggressively, every time anybody has anything that happens to them, the parents are running in and they're just scared to death that something's going to happen to their kid. So part of our job is to advocate for good, healthy, safe practices in sports, good, healthy, safe practices with protective equipment, but also balance that with just being reasonable. Because kids are going to be kids. They fall, they scrape their knee. We can't prevent all bad things ever, forever, but we can do our best to make sure that there's nothing lasting from it.
Okay. You spoke briefly about cerebral palsy.
Yes.
And is that something that can be gained over time? Like, you know, you could be born and then look fine and act fine, but then you start to see signs of it as the child grows?
So a better way to think about it is cerebral palsy is an umbrella term. So it means that there are people that have cerebral palsy, which is basically any insult of your developing brain resulting in abnormal reflexes or muscle tone. Okay? So if you have a very severe version of that, you will need a wheelchair for mobility, have trouble speaking and thinking on your own. But there's other people on the other end of the spectrum with cerebral palsy that all they do is they walk on their toes. They think, move around and act typically, they develop typically, but they have a little extra bounciness in their toes and in their calf muscles, so they walk on their toes. So it's easier to think about cerebral palsy as a umbrella term and then say what type of cerebral palsy. So it's not very typical that people will have no symptoms when they're born and grow into things. What can happen is that if you're born with a very mild version or a very small area of your brain affected, over the course of going from birth to 7 years old, your brain may rewire around some of those problematic areas, reassign some of those duties of that area of the brain that was supposed to be working that was damaged, and you could have some of the symptoms lessen or go away as you get a little older. It's not that your brain has changed the area that was damaged, it's sort of wired around those bad areas, and other workers in the brain have taken up that job that was vacant.
Okay, okay. One of a lot of articles on our site with children that may have had birth defects or things that happen where limbs are lost.
Yes.
Do extremely well on our site. But can you just talk about growing? Because, you know, as a child grows and then those limbs, you've got to be fitted for different things. But how does that, or how can we just better prepare for maybe a parent that has a child with a limb that's been cut off, or a limb that's been lost, or something?
So what we're talking about here is body image, self-worth, and self-esteem. That is not unique to my kids with disabilities. Actually, it's pretty applicable to all kids because children are very good at finding differences in school. It could be you wear glasses, could be you have braces, could be your skin is black, it could be your arm isn't fully functioning or formed. Okay? And I think the job of parents is to promote good body image, good self-esteem, but not avoid the honest question of if you are missing a limb, that is something atypical and different. And children start the process of self-identification with declarative phrases like, I'm a boy, I'm a girl. And anybody that's had a little boy that has decided to discover who he is, and they yell out for the first time at the checkout counter, I have a penis. And everyone at the checkout counter looks back. Those sorts of ways are how children define and understand themselves. And so I don't think parents should shy away from when a kid with a disability or some sort of birth defect says, I have a fill in the blank. Because they do. And the next question is, what does that mean to you? And how do you process that? And how does that make you feel about yourself? And if you can pivot all of those things to something positive, the sky's the limit.
Okay. A couple more questions.
See, sure.
So when a person comes to see you or a family comes to see you,
yes,
it can sort of be scary the first time.
Oh, more than sort of.
Yeah. So what would you, as a parent, talking to parents right now, what would you tell that parent just to expect, first of all, and then what they should do?
So I think in preparing to come to see someone, especially a specialist like me that deals with kids that have some sort of thing that makes them atypical, you're walking into a situation where nerves are high, people are holding their breath and waiting for the shoe to drop. So I think part of my job as a clinician is to recognize nobody chose to be there in my office that day asking those questions. Also, my job is to make sure to not be paternalistic and think and make decisions for them, or maternalistic and try to protect them from things I think might hurt them. My job is to lay out things as best possible. And what parents can do is try not to do the big crazy internet search. Because an internet search about a topic that's complicated from a person that doesn't know how to filter exactly what's legitimate and not legitimate is scary. And it makes you go into a situation with pieces and parts of information that may not even be relevant to your child and what they have. So start with the process of asking questions. The best thing a parent can do for their child is be their advocate. The best thing a parent can do for their child is to put them in front of the best people and the best resources to get the best minds thinking about what their needs are. That's what you can do as a parent, and that's enough.
Okay. Last question.
Sure.
How can people find you online?
I am Doc Mosho on Facebook, on Instagram, and on Twitter. I'm on LinkedIn at Maurice Sholas, MD. And I have a website, www.docmosho.com. DocMosho.com.
All right.
Come join us.
Yes.
Jump in, the water's fine.
Doc Mosho right here at the 2018 National Medical Association Conference. Thank you, Doctor.
Hey, thanks for having me.